Hello and a very good afternoon to all of those who are joining me live on the Facebook page of News9. I'm Neha. Well, if you remember, New Zealand was among those countries which declared itself COVID-19 free and was largely appreciated over its handling of the crisis as well. But in some worrisome news, the country is now tackling fresh cases as 13 new community cases have emerged. The World Health Organization, on the other side, has also issued a warning in this regard, requesting people not to take the threat lightly. Let's speak in detail as to what exactly happened. So the country which declared itself COVID-free did not report any locally transmitted disease for around 100 days. A family of 4, however, in Auckland with no travel history tested positive for the deadly virus. They also had no contact with any of the infected persons. This, in fact, has now forced the New Zealand Prime Minister Jacinda Ardern to impose lockdown restrictions in the city. The total cluster, in fact, the cluster has a total of 17 cases. New Zealand has 36 active infections as of now. The country has reported over 1,200 confirmed cases, while the death toll stands at 22. New Zealand Prime Minister, while speaking to the media, also stated that as we all learned from our first experience with COVID, once you identify a cluster, it grows before it slows. We should expect that to be the case here. It's indeed a cause of worry. As I mentioned, the country had been hailed across the world for its handling of the crisis. It's still not clear as to what caused the latest outbreak, since the country has already locked its borders for outsiders, also imposed strict immigration controls, and anyone who wishes to enter the country will have to be in quarantine for 14 days. On the other side, the WHO, the World Health Organization Emergencies Chief, Dr. Mike J. Ryan, while issuing a warning to the country, in fact, stated that not only to the country, but to all of those countries where the, infection is slowing down. He said that the calm waters does not mean that the storm is over. Absolute vigilance on the part of those countries which have reported progress. Little bit of compliance can mean the entire progress going down the drain. If we have to look at India's point of view now, the country stepped into lockdown in very early stages and was possibly able to stop the spread of novel coronavirus exponentially in the early stages when the country wasn't perhaps well equipped to handle the crisis. The graph is on the upward trajectory and will keep going, so until September or October as per experts. What we need to understand is that the second wave or the second peak can always come back to areas which are reporting less or no COVID cases. Well, speaking about India, we are still dealing with the first peak. Let's just quickly take in an expert opinion. Joining me from London is Dr. Neeraj Patil. Thank you very much, Dr. Neeraj. I completely understand you have a busy schedule. Thank you so very much for taking out some time and talking to News9. Sir, I'd like you to answer, initially hailed as the country, New Zealand, of course, which was able to stop the spread and report no cases, is again seeing a COVID-19 storm. Would you break down for us what does it imply?
Well, it implies there is a second surge. We all expected that there would be a second surge, and New Zealand was doing very well, and we don't know for sure why and how this second surge or the second cluster of cases have been reported in Auckland. And the Prime Minister has said that they are investigating this. So it is under investigation why there is a second surge in Auckland. And let me tell you that if you look at the epidemiology of COVID-19, the spread of the disease, right? You initially, yes, when the lockdowns were introduced, when there were stricter lockdowns and stringent measures introduced, the incidence and the spread of disease declined. But when the lockdown was eased because of economic reasons, the incidence and spread of disease increased. And this was along the expected lines. And as far as India is concerned, I think the graph is going up. The graph is not flattening. We are still in the first surge. So forget about the second surge. We are still in the first surge.
All right. So, Dr. Patil, as you mentioned, that lockdown is not a permanent solution to stop the spread.
Mm.
But what really can countries do besides following all the protocols?
Well, you see, countries have a difficult, challenging times because, lockdown, yes, on one hand, you have to do some lockdown measures to prevent the spread of the disease. But on the contrary, you have to make the economy running, the essential services running. It's a challenging task for all the governments across the world. Now, let me tell you what UK is doing. As you know, there is something called reproduction number. Reproduction number means that one infected individual will pass on to how many other individuals. So the reproduction number of SARS-CoV-2 is 3. So one individual give this infection to 3 people in a span of 4 days, and 3 individual will further give it to another 3 people in a span of further 4 days. If you take it like this, in by the end of 15 days, one single case will result in 40 cases in a span of 15 days. That's why you are seeing that in the last 15 days there is a huge surge of cases in India. Now, always the focus should be on R naught. If your R naught is below 1, then you can ease your lockdown measures. If your R naught is above 1, you have to introduce stringent measures. So again, yes, lockdown can be graded 1, 2, 3, but the whole idea is you have to just follow the R naught. If the R naught is 1.1, you need lockdown measures. If the R naught is zero point 0.9, then you are about to reach a danger zone. If your R naught is zero point 0.5, you can ease you can introduce, you can ease some of the restrictions. So the whole idea is, again, measuring R naughts in various geographical locations, mm, and and treating the disease locally. Now, like one size fits all doesn't work. The R naught of Bangalore will definitely be very higher than the R naught of somewhere in Karwar. So, you have to go on the basis of R naught.
All right. So, Dr. Dheeraj, India's curve is on the upward trajectory and on expected
Hmm.
lines, as I mentioned earlier as well. The country has been reporting rise in the cases exponentially, and we're still dealing with the first peak of the
Hmm.
pandemic. I'm not, of
Yeah.
course, which shows no signs of slowing down as of now. While on the other
No,
side,
no.
the UK graph is on the downward side. So, what
Yeah,
lessons can
yeah.
India really learn from the UK?
Well, the thing is, one of the things what I want to tell is, the graph. There have been reports that the graph is showing some signs of flattening in India. I'm not absolutely sure about it, but the most important thing is, introducing lockdowns based on R naught. So in the UK, lockdowns are introduced based on the R naughts in local areas. Like Aberdeen has gone for a lockdown because the R naught has gone up. So my simple message to India and Indian governments is, please measure the lockdown R naughts in the local area, and then again, uh, take your policy decisions based on your R naught. And again, yes, social distancing, educating people about social distancing, educating people about hand washing, educating people about importance of wearing a mask. All those things government has to continue. And the only thing, the big ray of hope I see these days is a vaccine. I expect a vaccine to hit the market in October.
But why is it taking so time for the vaccine to come out? Is it because of the complex nature of the virus?
No, no, it is not at all because of the virus. It's a simple RNA virus, but you have to remember we have to make sure the vaccine is safe and effective. So you have to go through all the clinical phases of all the phases of a clinical trial. You can't jump them because one of the things you want to make sure is the vaccine is safe and effective, and it does. In fact, I have to say the production of COVID-19 vaccine is going at a lightning speed compared to other vaccines, and I expect it to hit the market in October.
All right. So, Dr. Patil, do you think that India is anywhere lagging behind when it comes to tackling COVID-19 pandemic?
Well, the thing is, I think India has done some good things as well because you see, India introduced early lockdown measures, and that is exactly the reason why we are doing better than Brazil. Had we not introduced early lockdown measures, we would have been far worse than Brazil or America. And we have to applaud the current government, the state and the central government, for introducing early stringent lockdowns. But again, it's the people, how far can you contain people in solitary confinements? That's a challenge, and India has a huge population. It's very difficult to introduce lockdown in a city like Mumbai or Bangalore, but on the contrary, it is very easy to introduce a lockdown in a city like Nottingham. So you must understand the scale and the challenges. So I think India has done overall very well, but what I think is, is just educating people and telling them,
Dr. Patil, are you with us?
in place.
All right, so go ahead.
Yeah, sorry, there was some communication. Can you hear me now?
Yeah, I can hear you, sir. Please go ahead.
Uh, so the other thing what must remember is, one of the things I would suggest to the Indian governments is focus on the vulnerable population, which is people who are above the age of 50 and people who have underlying comorbidities like heart disease, diabetes, hypertension, lung disease, liver disease, kidney disease, immunosuppression. Focus on these high risk individuals, making sure that they are isolated and they are not exposed to people. That's where the whole focus should go on.
Right. All right. Thank you so much, Dr. Neeraj, for joining us live on the Facebook page of News9. Well, there is one lesson certainly that all of us can learn and we should learn is that there is no need to let your guard down, even if the place you're in is showing signs of, is in fact slowing down. So thank you so very much for joining me on the Facebook page of News9. If at all you like this video, do not forget to subscribe News9 YouTube, like us on News9 Instagram, Facebook, as well as Twitter. Do remember, calm waters do not mean the storm is over. Thank you very much for joining me. Take care.